It's coming down.
Correct.
Yeah, it's coming
I guess
down. So
let's hold off and let's see how it
Sounds
goes.
good.
Clinically, it looks like
We started in about March when we saw our first cases here, and it was obviously very new to us and scary. And then it slowly picked up, and then summertime it mellowed out a little bit, so the staff had a break, and then come, September, October, it severely picked up here. So this is kind of all we've seen so far is COVID this year.
No, they said they're gonna do it, but just, I don't know when.
Okay.
They said they'll call me back.
So you had the 2 orders of fentanyl, right? So give the one now, and then wait for the second one when you move it behind.
This time around, there's multiple people who are getting put on ventilators, having to be paralyzed, put on their stomach. We also have what's called ECMO. That is another form of when their lungs are completely not working anymore. It's a machine that takes over on top of the ventilator. Patients are a lot sicker this time around and are unfortunately staying in the ICU for longer as well. It seems like the disease process is taking a lot longer. It's hitting them harder and taking longer for them to recover. It is very hard, to be having to have conversations over the phone about difficult decisions and listening to family members be so upset, and we are here for them. We encourage them to call and just, even if they want to have the phone put up to the patient's ear so they can talk to them, we encourage that. But we are here for them as much as we can be, and we ensure them that we're there with their family members every step of the way, holding their hands.
They're completely exhausted when they come to work. At least in the springtime, it was new and novel and people were ready for it, and we only had 40 patients with COVID. Now we have 173 and they're exhausted. They've been ground down to a pulp over 6, 7, 8 months. I don't know however many months it is, but and now we have 4 times as many patients.
We had, I think, 3 patients pass in one day. It was rough. One of them was, the family was ready to withdraw, so that, they were at peace with that, and we were there for them. But another family member just wasn't. They just wanted us to keep going, and there was just nothing else we can do. And listening to them call you and say, please keep going, and there's nothing else for us to do. It's sad. It's frustrating.
And I've never seen it this busy. I've never seen patients this sick. So it's emotional in the sense that it's sad to see the community go through this, and for us to have to care for these patients that are isolated from family and friends. I think it's also rewarding in watching the staff and how caring they are.
They still keep digging deeper. You see them, they don't complain. They're kind of enthusiastic, we got this as a group. We're not individuals, and nobody wants to let the other person down.